And so documentation becomes very difficult if you're in the periphery, because you don't have the honor of having experienced people helping you. So those are some of the things that we'll have to look at to be able to support our peripheral facilities, so that they don't have to travel all the way to Kisumu to deal with small things. Probably have some peripheral centers with a set of accountants, something which is similar to what we used to have as a district accounts office, that does examination of vouchers and approval of vouchers and payment at that level before they are brought to headquarters. I think I want to end there. I want to allow also my chief officer to say something before he allows the individual facilities to discuss or to say one or two things about their challenges. Thank you very much.
Thank you, Waziri, for giving us that elaborate presentation. I mean, having said what our Waziri has said, even the procurement personnel realize that outside GOTRH and KCRH, all the other facilities do not have procurement officers. The procurement officers are the fellows that really make sure that the processes are done in a very professional manner. Yeah, but apart from that, we should not, as leadership, appear to be giving excuses and reasons for those disclaimers and stuff. These guys are adults, and they should take responsibility for their sins of omission and commission. They are all here, and they should be, you know, able and ready to answer to the concerns of the auditors. I think I will leave it there. We should not be appearing to be giving excuses for. If you look at some of the documents that the editors were exposed to, some of them look very bad, by the way. And you just see intent from very far, that there was an intention here to do one or two things which are not very right. So despite the fact that there are no accountants, no procurement officers, I think we are still culpable for some of the things we've done. Thank you very much.
Yeah, I believe there are things that some of them can be sorted out, like the issue of KCH, where there's a report that the board of management of the hospital board has been there for more than 3 years. They were supposed to be there for 3 years. And they've kept on drawing money for the allowances. Yet the board expired a year ago. So those are things that should not even appear in the auditor's report. There are things that we can manage. The hospitals in questions are 6. In fact, there are 8. The referral hospital 2 plus the county hospital 6. So we expect responses from 6 hospitals. The county hospitals. I believe you know the county hospitals. So they're only the ones that we are going to deal with. The other hospitals, you'll just relax and enjoy the atmosphere.
No, Chair. This, well, we will leave them for today, but even some of them are crime scenes.
Yeah, okay.
I'm sorry I'm saying this on a live...
Yeah, true.
You should not sit pretty. We are coming for you. So Chair, with your permission, then I would wish to invite them one by one, the big facilities. Let's begin with the GOTRH, the mother of all hospitals in Western Kenya. You know your issues, so with guidance from the chair, then we'll know what the chair wants to hear and the members of the county assembly want to hear from you. Thank you very much.
You have an issue?
Thank you, Chair. First of all, I am not a member of this committee, but I am the chief whip. I'm allowed to sit in any committee whenever I feel like. And today I'm sitting in this committee as a result of various audit reports which were presented by the Public Accounts Committee in this House and adopted. And I'm happy the Chair of Health has convened this meeting not only to interrogate but to find solutions to problems bedeviling our county as far as health is concerned, especially in our sub-county hospitals. Chair and Honorable Sethu Kumu will reaffirm this together with the members present in this House. The audit reports in those various sub-county hospitals were not very welcoming. And sometimes the members of the press are in this House monitoring how we go through these issues. Chair, there is a tendency, contrary to the public finance regulations. And Mr. Chair, you can go to regulation number 11 of the Public Finance Management Act, what it entails. That an accounting officer cannot be transferred to another facility if he has not handed over the relevant documents provided or required by any audit entity. And Waziri, you should go and check on that. Regulation number 11 of the Public Finance Management Act. Check on it. What the law requires on transferring an accounting officer. There's a tendency of just transferring accounting officers, Mr. Chair, in this county, whereby one has committed serious financial issues in a department or in an entity, and the Waziri is just transferred to another facility. I think, Waziri, you should cure that as the head of this institution, in this department, by ensuring that once an accounting officer has committed some serious financial issues, because we are talking about prudence use of public resources, you should ensure that he is answerable. And we are on this, we are not going to deal with you with the hands of gloves, the way the chairman is doing. Because us, when it comes to 5 years, the end of the 5 years, the voters do not always deal with us with hands of gloves. They go for it, and you are voted out. And this time around, we did resolutions that once an accounting officer has committed an offense in his or her department or accounting entity, he or she should not be transferred to another department, Waziri and Chief Officer, before he answers these audit queries. Because Seth, you were there when these glaring audit queries were being read in this honorable house by the chair of the Pick and Pack. And sometimes I, together with the majority leader, our duty, you do not appear in this house when these audit reports are being read. But our duty is to defend the government in this house. How will you defend such discrepancies when they are very glaring? So going forward, Waziri, just help this county. You have tried. I'm not saying that you have tried. Since you took over with the Dr. Lucy, there are systematic changes going on in the health department. And I appreciate you for that, your team, together with all the in charge of the sub-county hospitals. But now, the prudence use of financial, the FIF, you'll find instances whereby non-contracted is neither contracted nor permanent employee collecting funds on behalf of the county government of Kisumu. How will you deal with such an officer when it comes to human resource issues? There were serious issues where the COVID funds were spent to buy assets. And when you go to records, the assets are not there. So going forward, I'm just pleading with you together with the team that Kisumu County is us. We are Kisumu County. There's nobody will come to this county to help us. And the governor has got a very good policy on health. If implemented Waziri, like the way you are doing, and be firm. Be firm to the chief officer and there. I'm transferring of people, removing this one to Obewa Health Center, removing this one to Yando. You're not solving this problem. If you are responsible, either go home. Yeah. I don't want to speak much here, but thank you very much for allowing me. But I was just raising the concerns.
Thank you, Honorable Member.
Thank you, Chair.
Honorable Member, I want to agree with you on the issues of accountants. I can remember there's a day that the Pick and Pack summoned the team from Lumumba Sub-County Hospital to appear before the committee here. The accountant disappeared. She did not come here. When she was being looked for, I don't know, she switched off the cell phone. And after 3 days, she resurfaced, and she could not even say why she decided to disappear. But she was claiming that she had been transferred. But the transfer letter came a day before the day she was to come here. So then she decided just to disappear that way. I think if you see her somewhere, tell her that we are still looking for her. In good faith. We need to see the accountant for Lumumba in good faith, because there are issues that the medsup could not respond to because she's not an accountant. So she came here and there was nothing we could establish from the hospital. Thank you, Dr. Lucy, and the statements of Honorable Seth Kanga. I think now we can proceed to JTRH and KCH as we go down, scale it down to the other facilities.
Thank you, Chair and honorable members. I'm from JTRH. JTRH got qualified opinion, and the basis of the qualified opinion was one, lack of internal audit department. And therefore, as a presentation to this House, my suggestion is that the whole health fraternity, we can create an internal audit department, because I believe this was an audit query across the board. The issue number two that led to the qualified opinion was the issue of human resource in terms of understaffing. When they went round and they were comparing the level of the hostel vis-a-vis the number of employees, then they realized there were some gaps in those areas, including equipments and specialists in those areas. That also led to the qualified opinion that we received. The other issue was the issue that affects the transition of the national government and the county. When devolution came about, the assets have since not been transferred by the national government. Some of the assets that we have are still being held by the national government, like most of the motor vehicles. are still with the national government, and therefore they were not able to ascertain these logbooks and the rest, and that led to the qualified opinion that we're able to get. The other issue on that was the absence of a title deed of the hostel, of which that is also one that led to us getting the qualified opinion. The other issue was the valuation of assets, of the hostel assets. By that particular time, the hostel had managed to value the land and the buildings of the facility, but they had not managed to value all other assets of the hostel due to the huge amount that is required to carry out that valuation. The final issue that was raised by the auditors was on the issue of waivers and exemptions, of which they were not satisfied with how we could go ahead and do waivers and exemption, as the PFM Act states clearly that waivers is a role of the CEC Finance, and therefore they were querying that. The other issues that they queried were basically on just the realignment of the account, the financial document, of maybe the numbering, the headers. The header, sometimes we are using abbreviation of JOTRH instead of using Jaramogi. This, at least going forward, I think there are things that we can be able to manage. Thank you.
Thank you. I think we are noting them down. We'll respond to them, a few of them. We can move to the next facility.
Yes, Chair, we may want to move to the Kisumu County Referral Hospital, KCRH.
Thank you, Chair. My name is Barak Odwar. I'm the accountant, Kisumu County Referral Hospital. We equally received audit queries, and some of the matters that led us to have a qualified opinion were: one, there was this issue of budgetary control. They were asking why we could not report the amount allocated to KCRH of total shilling 60,500,000. We reported an amount with a variance of 12,104,845. But Chair, this was not our making. The refunds are gotten from the exchequer, from the county, and they arrived late. So we are able to explain that with evidences. The other issue that they were talking about was trade and other payables. These were related to casual wages in arrears, which was also a cause of the delayed funding from the county treasury. So by the time of the audit, we had an outstanding arrears of close to 6 million. So they had an issue with that. And we were able to explain it to the best of our knowledge. Another issue that arose was the long outstanding pending bills, which at the time of audit, KCRH had a total of 135 million. This also partly was attributed to our shortfall in collections, and it was true that by that time we had such huge pending bills, and actually as an entity, some of these pending bills, if we can't get some assistance from the mother county, which is the headquarters, to some level, they'll still continue appearing, because if you check at what we collect vis-a-vis what we are supposed to pay, might take a tall order to clear. It might take a while. Another issue that came to that audit query was failure to meet level 4 requirements, which to some extent was beyond us, because in our response, we managed to inform them that some of the requirements could not be met by the facility solely. It had to be in conjunction with...
Just to cut you a bit, on the issues, on the opinions that were raised by the auditors, we need to know from you how would you want us to help you? How would you want the county to help you so that we don't have a similar, we are not found in a similar situation?
Thank you, Chair. So, issue like pending bills, Chair, I'd appeal to the county to just maybe increase the allocations that KCRH is given. For example, the financial year under audit, KCRH was allocated 60,500,000. And the current year that we are in, we've been allocated 42 million. So the variance was not even explained. So we are expected to operate at the same level and purchase commodities, which as we speak, have...
Point of order, and I think it's bringing it okay. One, on the 60,500,000 for that was in the audit query. I think I've just heard you say that the money was given to you, but it was given late. While in the report it was an underfunding, that you did not receive all the monies that was in the budget that was supposed to be sent to KCRH. But other than that, Chair, he's saying that their budget was reduced to 42 million. I believe the budget comes from the executive to this assembly, and the department receives the budget from these hospitals before they can compile them and send them to the assembly. I have never heard where we sit down and decide to reduce the budgets of any hospitals. So I don't know how it comes that their budget was reduced, or they are the ones who under budgeted. Thank you, Chair.
I think you need to explain that because we've never sat down as an assembly to reduce your budget. So if you tell us to increase it, we don't know from where to where. We didn't even in the first place reduced it. Thank you.
Thank you, Chair. Okay, based on the figures that I have, Chair, the last budget was 60. The financial year under question, we had an allocation of 60,500,000. So the current financial year that is still running, we are operating on a budget of 2 million. So at the point that the reduction was done, we must not be...
From that submission, it just seems that this hospital just receive lumps of money and then that's when they decide what to do with it. What I think the practice should be, they have a budget and then you fund that budget. If you had 60 million, you can even be having 20 this year because maybe you finished what you were doing last time and now you have reduced your budget. But from the explanation, Chair, we are having this problem. It's like, let's just decide to throw 20 million to JTRH, 100 million to KCRH, and let them decide what to do with it. I think from that on submission, I think you see where this audit report questions start and where pending bills originate from. Thank you, Chair.
Yeah, because I believe budget goes with functions. So if the functions were reduced, you don't need to go to those functions that were reduced. But again, that one happens within the department, not even at the assembly.
Thank you, Chair. Allow me to continue the next item.
Okay.
So, another issue that came up was a failure to meet level 4 hospital, which in our response, we responded that the services mentioned required specialized trained staff whom had not been employed by the County Public Service Board. So even this one was beyond the facility, Chair. Another issue that came up was expired term of Board of Management, which by then it was true, the term had expired, but this we explained that it was the prerogative of the governor to appoint board members, which was done with Gazette notice dated 15th, we attached and responded to that query, Chair. There was another issue on effective control on cash collection, of which this one we've rectified, we've gone cashless. And so far, I believe, since we've adopted the best practice, it might not appear under our queries. Thank you, Chair.
Thank you. If I look at the issue of lack of effective controls on cash collection, there are things that were mentioned here that sometimes I may wonder how you are working with the safe box. The safe box used for safekeeping daily cash collection had broken lock. So the safe box had a broken lock. The cashier and the collection point did not have a ledger book to record the daily cash collections. You are just collecting and dumping them somewhere. There was no ledger book. The students are the one managing the cash collection. See, there are some things that you have not talked about them, but they were mentioned there.
Thank
I
you,
don't know
Chair.
whether you've changed now.
Thank you, Chair. So as we speak, we've changed all those. The safe box is currently intact, though we don't collect cash anymore. So on the students, we were privileged to be seconded as some staff from the Revenue Board. So currently, we are using staff, not students. Thank you, Chair.
Thank you, Chair. Chair, I think the facilities submit their budget to the department. So on the reduction, we have the chief officer. I think he'll be able to explain why he decided to reduce your budget.
Chief Officer, why are you punishing KCH by deducting their budget?
Chair, we love KCRH so much that we give them what we get with respect to the ceiling that we get from Treasury. Of course, a lot of times it's not enough, but we say that, yes, the same breath we say we must also improve on our FIF collection. And I think KCRH is on the right trajectory. As you hear, Chair and members of the Assembly, they have gone cashless. If you ask them now what they collected the last quarter and what this quarter is ending in the next, I think, 10 days, you see a lot of improvement, Chair. So we want to encourage them to seal their loopholes and get the money.
But why should they budget with what they don't have? If you are able to give them 43 million, why should they budget with 60 million? Where will the rest of the money come from?
We are streamlining the running of this department, Chair. And one of the things that, and I want our accountant, Letitia, to talk about this so that we can think on the same page, is that now their procurement plan. Initially, what these gentlemen and ladies had was that they would get, there's no maca, they just buy maca. There's no Panadol, they just buy Panadol without knowing where the money will, inviting people to bring in supplies without knowing where the money will come from. But now we have gotten procurement plans from them, and nothing will be done out of the budget. And if you allow me, sir, I would want to ask Letitia, our accountant, to shed more light on this particular issue.
Thank you, Chair. Chair, just on the same, the chief officer is saying that the collection is improving. It is on the upward trajectory. Then I think there is no need of reducing the budget. I think the budget should increase because they are doing good work in terms of collection. And two, in your opening remark, you said that these facilities do not have procurement officers, but I can see they have accountants. So I would also like to know who does the procurement work in the facilities.
I will respond together. Or you, okay.
Sure, that is one of the reasons that you called us here to see where this assembly, honorable assembly, can support us. You will want to sympathize with us that there is no procurement officer in Kumbewa, Tulaimbo, Ahero, Nyakach, Muhoroni. There's only one in KCRA that is supposed to be supporting all this. So again, we are here to seek support.
Letitia?
Thank you, Chair. The year under review is 2021-2022. We are in 2023-2024. So when my fellow accountant is saying that the budget was reduced, In 2021-2022, their budget was 60 million, minus the FIF. Today, what they are expecting from the executive or from our recurrent budget is 42, but plus their FIF. So I know and believe that they have a much bigger budget now than they had then. They do. Can we confirm?
Is it the accountant for the KCRH? The departmental accountant is saying that you are getting 42 million plus the FIF fund. Put together, it's above 60 million. And you say that it was reduced. Are we on the same page?
Chair, we are on the same page, but what I'm stating is that the recurrent, what we are receiving from the county, in the financial year under question, we received 60, we were to allocated 60 million 500. This time we were allocated 42 million. I was not referring to FIFs.
What she's saying is that the 60 million was the total amount that was allocated. But this other year, you allocated 42, but there was some money somewhere that could even surpass that 60 million. Because you're saying that the other issues that were affecting you because the money was reduced. But she's saying that the money was increased.
From that angle, then, I'm sorry, sir.
Let's proceed to the another facility.
Chair, before we proceed, I am just on KCRH. I think when they came, they had a problem with the software they were using in terms of monitoring their collection. I think it's the FundSoft, something like that. Maybe I want that one to come out very clear. If the problem is solved, or we are still having problem with the FundSoft. Thank you.
Thank you. Through the chair. It's true we had a problem with FundSoft, and currently we've deployed Elephant, of which began operation mid-October. So we are still testing it. So with the FundSoft we've halted, but we've not taken it out yet, because we are still seeing if Elephant could have the same challenges as FundSoft or not. So we've just maintained it, but we are not using it. But we are using Elephant. Thank you, Chair.
Thank you, Chief.
Thank you.
And sure, your mic is on.
We received disclaimer for Kombewa County Hospital, and we had a lot of issues that was noted by the auditors. The first one that we received was the board. They had less than 4 meetings in that quarter, and we did not have any of their files fully. So for that one, I think for now we got their appointment letters from the department. We've also worked with them, and they've given us their CV, their photos, and any other requirement. For this financial year, we've had 5 meetings, meaning we've exceeded the 4 that was recommended by the auditors, which is a good thing for us. On number 2, as a facility, Kombewa County Hospital, we are actually expanding. And right now, I'm actually supposed to be in theater or somewhere, but I'm here because of the shortage. That was also noted by the auditors. We have 2 medical officers. We have 1 surgeon and 1 physician. So it means that the med-sup is also the accountant and the procurement officer, and any other job that is there for us. We've actually done good with that, because as you can see, I'm here representing as a med-sup, and if you call me at night, you'll also find me in the hospital and do the emergency if it's there. But that also means that there might be one or two gaps, because if you go to the facility now, you will need to find somebody. Or if you go to the facility and I did night, you will not find somebody. The HR issue was actually a bit big on our side, because by then we were talking about a deficit of over 50% of the healthcare workers. In nursing, we only had 35 nurses. They recommended that we were supposed to have 100, though this is as per the international standards. For Kombewa County Hospital, with the services we provide, we are supposed to have around 45. The lab, we have 9 people. We are supposed to have 24. Clinical officers, we have 11. We are supposed to have 22. This one, the department has been working on, and from that time we've received some stuff, around 9 in total, which is also a good thing. So when the auditors came, we didn't know what they wanted, and we also didn't have those things. An example, they asked about title deeds, and for us, we were told about the title deed, the process had started.
We said that if the title deed had been mentioned by somebody, we take as a general thing for the title deeds. You just go to anything that has not been mentioned by the other facilities. Because I can see you have unsupported trade and other payables. You pay people you don't record anywhere. Those ones you don't want to mention. You are mentioning title deeds. That's a cost board. We need the nitty-gritties that are there. Unsupported general expenses, unsupported transfer, lack of support documents on medical services. Patients come, there's nothing to show. You just charge, I don't know. Those are things that we need to care.
On a rejoinder, maybe through the seas. I happen to be in Tech Park and also in health. It's appearing like we are making our facilities procuring entities, and CC, you understand that. And you appoint accounting officers to all these facilities, but you don't tell them the responsibility that they hold. From submissions of the med soup of Kombewa, I mean, he doesn't know that there is legal implications when it's being audited. And he says he didn't know what they want. It means by the time he was agreeing to be an accounting officer, he didn't even know the legal responsibilities that they are holding as per our Public Finance and Management Act. Yes, they are accounting, but we are failing them. We don't induct them so that they take responsibilities. You know, some of these simple mistakes will remain on them. They will not come to you. They will not come to all those people they are mentioning on the board. The expenditures solely lies on them as accounting officers. If they can't keep records of things that are happening, if they can't even keep minutes, they have meetings and they can't keep the minutes, and those people are paid, you will not be looked for chief officer, neither is Ganda. They will be looked for individual. And when you come here, sometimes we almost sent away the departmental officers because we wanted the officers who are audited. And from submission, now I am here as a member of Health Committee. It's appearing that our accounting officers, who are the med soups and what, they don't know their risk. Please take them for some induction. As we go for this budget, let's have some money to take these people for induction, so that if you are agreeing to be an accounting officer of a facility, know their responsibilities you are holding as an accounting officer that you are granted by law. And if you don't take those responsibilities seriously, you'll be held individually responsible. Nobody will come for Ganda or Dr. Lucy. Thank you.
You are the secretary of a board of a hospital, and you're the person who is supposed to take minutes. And if the auditors can't see any minute and you've been paying money, how do you expect even us to help you?
We actually didn't have the meeting, so we didn't pay them.
Chair, I don't know, but it's really funny. Chair, and I think the department, I think we should make sure we tell our guys who are the accounting officers to our facilities the implication. You see, once the audit report is with the assembly and the assembly makes a recommendation, you are liable to be charged in court, and you are liable to even be jailed for what you did. Just like a headmaster in a school, when he has a board meeting, there must be attendance, there must be where they sign for the money. And you find, just 2 days, 3 days ago, we had a facility here. The board members sat, they chewed almost 600,000 for the entire financial period, but above, even how much above what they budgeted for. And there is no record, there is nothing, there is no attendance list. You know, this is the grave how this thing is. And when we come here as health committee, we want to really cure all this so that there is no way you will say you didn't know. You will be liable for that. And I think all of us who are med soups, please take note of that, because it is not that simple. Once the recommendations are done, it is done. And you will be very liable for that. Thank you, Chair.
Just final one, then we go to...
Hello. Chief, just hold your horses. Chair, I think the Med-Soup of Gombe has just said that they've had 5 meetings. And I'm really wondering, because even in the village I see, in the chamas, the old mamas even do minutes. Now when you talk of a whole Med-Soup not doing minutes, then something must be wrong. And I would like to ask the chief officer at least do something about it, because we cannot just talk about missing minutes, surely. Thank you.
And remember, you need to have photos of the board members and their papers too, and their qualifications. I think that is a requirement. You don't need to be reminded by the auditor that have photos.
Through the chair,
You can proceed.
So the 5 meetings we had, we have all the documentation, the attendance register, the minutes, and also the payment schedule signed as per the requirement or the recommendation of the auditors for the 2021. For 2021, actually we are going through a rough patch because there were a lot of changes, and that's what happened during that time. From 2021, 2022, we've made some improvements, and an example I was giving was the board. In 2021, 2022, I think the recommendation was we did not have minimum of 4 meetings for the board. We had only 3. But in 2020, from that time, we've had the quarterly meetings, and all the minutes are there, plus the attendance register and the payment schedule. We've been doing that. That's an improvement from what we got from the auditors. On claims that we did spend some money without proper documentation, also that was also part of our queries, and actually we noted it. There were some of by then we did not have an annual budget. We were spending based on allocation from the department. But from the year 2022-2023, we have an annual budget that we are supposed to check into. And also we have to spend after we've gotten an AIE from the Chief Officer of Health, which is something that we were not doing by then. So that one should not be another query for this financial year or last financial year. So those are some of the improvements. Actually for us, it was a learning process because this was the first one. And from what we got, we actually improved the systems we have. Yes, there are some that we still don't have, like example have been talked about, the buildings that were made by the national government, they never handed over the documentation, so we don't have that one. But the rest of the things that is within our power, we've done them. And if you come to Kombewa, you will see there are some changes, just as KCRH have also said. On other financial issues, we have a lot of pending bills, and that's yes, we have a lot of pending bills. This was mainly because we are living out of our reach. Like you find by 2021-2022, we had we had not paid our support staffs around 1.4 million, which was noted by the auditors. Since then, we've actually improved, and we've been paying our casuals every month without any delay, because that's actually one way to motivate them, but also not to get another audit query on the same. We have some other pending bills.
Are you saying that you are up to date with the payment of the casuals?
With the payment of the casuals, we are up to date.
Okay.
Another issue that it was bringing the pending bills was.
Okay. Chair, the gentleman over there is not taking the work of this county assembly seriously. First of all, he's talking about physical changes in the facility. We are not talking about physical changes in the facility. We are talking about fiscal issues, whereby the Auditor General has highlighted issues and challenges in that assembly. And as a result of that, there is a disclaimer in the audit report of 2021, 2020, is it? 2021, 2022 financial year. And the assembly has gone further to make recommendations. You are talking about what is happening in the facility today or yesterday. Yet that one has not been verified by the Auditor General. Yet you are having a disclaimer. You know, a disclaimer is something which cannot be talked about. I'm not an auditor, but if you Google, some of us who happen to Google a lot when we don't understand things, you will understand what a disclaimer is as far as audit issues are concerned. Yet the officer is still at that facility running another financial year. So Waziri, something needs to be done. And the officers need to take their work seriously. I'm pleading to the department so that, even qualified is still an issue when a facility has a qualified opinion. There is no unqualified opinion as far as audit reports are concerned in matters of health. So, he's called Mr. Who? Mr. Vincent, you have a very nice name. Try, because the chair has been very, there are recommendations, chair, as far as the audit reporters, which was read by the chair here. They were given 90 days, you guys, to respond to those issues. So, and the chair has also gone further to hint for you. So you guys work on it so that when the 90 days elapses as an assembly, we are able to get something tangible which can help us move forward as an assembly and as the implementers of health decision in our county. Some of us, we go, when money is not used prudently, service delivery cannot be realized. Waziri and the chief officer. And some of us, we happen to attend funerals. Just 2 weeks ago, we were attending some funerals whereby residents of Kisumu were talking about their experiences in our facilities while they were saying they are nano. And they were challenging us as representatives of the people to talk about these issues. Where they were talking about even granulars are not there, the people who are serving them are not health officers, some of them are sleeping at night. Yet when you tell them that, he's saying that is a casual, glaring experiences. Chair and Waziri. So, Chair, I love this meeting, but let's use this meeting to move Kisumu County from strength to strength. Thank you.
I just want to confirm to you again that we are not here to witch hunt. That's why I said we are here collectively to find a solution for these issues. Because these glaring issues, if we don't discuss them, they'll find their way to Senate. And it will put the governor on a very bad picture. You know, there are things that we get from the facilities, like a health sub-county hospital. At night, they don't collect money at night. At night, money is being channeled to the person who is seeing the patient. At night, the money inaenda kwa mpesa ya mwenye anaona mgonjwa. People working at the OPD. And we get this information, as we have the information. So we may not just come there, but we get the information that me, I paid the money to an M-Pesa to the doctor who was seeing me. And we were many, we've been paying. That's how we've been paying. And we expect FIF to work. So these are things that happen. We are not just talking about them anyhowly. So when you come here to the assembly, you see some of these things can land you into jail. But we feel there's a way we can help one another so that we sort them out without tainting your name, that the facility in charge mismanaged, because you are the accounting officer, mismanaged everything, even if it was not you, but now you are the accounting officer. So all the blames will go to you. I think I'll give you 5 minutes to summarize, then we go to the next facility.
Because it will be an excuse. I'm the accounting officer now. So the issues that were brought by the auditors, we are handling them, and the documentation that were not there can be availed to the assembly anytime if we are required to do so. Also, there are some issues about FIF that has been discussed, and for us as a facility, we support FIF because we know what it can do and how it has changed Kombewa County Hospital. On going back to matters of some of the challenges that we faced or that made us get where we are, all we can say is I think it's more of a teamwork. If we can work as a team, then these things will not happen again. As I said, when the auditors came, they gave us a letter and a list of what they required. We tried getting what we wanted, but now when they came, that's when we realized that whatever we were doing was short of what's required of us. An example will be on maintenance of motor vehicles, where what we knew we were supposed to do was just to do an LSO, give somebody to do it. Then later we came to realize that we are supposed to actually accompany those documents with the logbook that the person who was doing the maintenance was supposed to write what he has done and what's required. Something that we've since started. And also, there are some things that I don't know if we can change them now, but some of them had already happened, like the use of AIE, the budget, which we did not have at that time, which we now have. So all these things we've been doing because we want our patients to go home happy, and also we want to actually help the governor in becoming one of the best healthcare systems in Kenya, which I think as for now we are heading there. So we got a disclaimer, and as a facility we are worried about that. We didn't know what it was by then, but we've since researched and we know what it is. We thank you for the opportunity.
Thank you. Let's move to facility. Seth?
Thank you, Chair. I like the honesty. I think that's what motivates me to always be inviting them. Chair, our intention is to improve. I want to say that we've not invited Kombewa for PICPAC meeting. I know we will be inviting them, despite the fact that they have a disclaimer and they're really trying. What's important, Waziri and Chief Officer, let your accountants help them answer those questions. Maybe they got disclaimer because they could not answer the audit queries as was requested. Not that they didn't have the documentation. So that when they come for Public Accounts and Investment Committee, I don't feel embarrassed. Because when you come there, I'm a different person. I think they'll attest to you. Because now it's my oversight role being at play. But right now, we are just trying to see on how we can avoid some of these things. So please, the department, assist these small facilities so that when they appear before the committee of PICPAC, we don't feel embarrassed. Thank you, Chair.
Chair, I think that's why the accountant for Lumumba disappeared. Because disappeared for 2 days. We can go to the next facility.
Chair, and please, people, please, when you should learn from others, you know, from what Bernard of UTRH presented, from what Barak of KCRH presented, and the issues raised. You should learn from what they have done. You know, you do not just expose your ignorance here. And I mean, if you're being asked about documents you did not keep, do I need to instruct you to keep documents? Thank you, Chair and members of the Honorable Assembly. Ahero, please.
My name is Dr. Vivian, Hero County.
Why is the same?
Yes, my name is Dr. Lillian, Hero County Hospital. So we also got a disclaimer report from the auditors, and majorly the concern around the report was mostly related to the weakness or the poor.
Try to put the microphone closer because there's some.
So okay. The disclaimer is mostly because of the poor accounting and procurement processes, because what the concerns were mostly financial. The first thing is the non-compliance with the prescribed financial reporting requirements. There was lack of a trial balance, and there was a lot of inaccuracies in the revenue reporting. There was also variances in the financial statement and the ledger amounts, inaccuracies in cash and cash flows. There was anomalies in the statement of comparison of budget and actual amounts, and unsupported balances in the financial statements. And there was also undisclosed balances, and there was also the query of non-retention of our own generated revenue.
I want to help you. I think we have these notes.
All right.
So I don't think you came here to wait for us these notes, because we have them. There is something we want you to do, and we've explained to you what to do. If we have it, we can read it.
Right. So what I'm trying to say is the report comes as a result of there was poor accounting. It seems like some documents or a lot of documents were not submitted to the auditor. So that's why there was a lot of inaccuracies. But we went back to the drawing board. We were able to go to our bank statements, vouchers and all that, and we were able to reconcile some of the differences that were reported. There was also the query of weakness of procurement. Like other facilities, we don't have a procurement officer. But the facility has tried to also improve on that, and we've also actually come up with an inspection and acceptance committee that is usually appointed on a quarterly basis. There was also the question of long-standing debts. As like other facilities, we are not able to be on time with all payments because of the funds that we get are not sufficient enough. But moving forward, we are trying as much as possible to clear debts using the recurrent. There was also the question of expired pharmaceuticals. Also goes back to the weakness in the procurement processes at the facilities.
Expired pharmaceuticals within the hospital?
Yes, we did.
And you were using them?
No, they were not being used, but they had not been disposed. Also, we had the query of the irregularities in the constitution of the Board of Management. So there was the query that our board only met twice during the financial year of 2021-2022, and it had excess members in attendance than those who had been appointed. Going forward, the hospital has tried to stick to follow the guidelines according to the FIF Act 2015. Thank you.
But James, you have something?
Chair, I just wanted to ask the Med Super Vaero, if at all the queries you've mentioned, you've answered them to the auditor.
Yes, we've answered them to the best of our ability.
Move to the next facility.
Thank you, Chair. The next facility should then be Nyakach County Hospital.
Is it Nyakach or Papunditi? You have it in mind that we identify the problem, and you tell us how would you want us to help you sort out that problem, and if it is within you, how you are going to sort it on your own. But if it's something that you need the attention of the department, the attention of the assembly, then you tell us how you'd want us to help you sort out the issue. Because we are taking minutes and we need to compile the meeting and maybe give a report to the assembly.
Okay, thank you, Chair. I'm Mr. Abraham Abuto by the name. I was just called from the facility to present the MedSoup Nyakach County Hospital, who was to attend and answer the various questions as in the audit query. He apologized. He is having an emergency and he's rushed the child to Mombasa. The human resource has been mentioned. And
You said, who are you in the hospital?
I'm the HO. Hospital administrator.
What? Eh?
Hospital administrator.
Okay. You can proceed.
Yes, the human resource is a very big problem in the facility and was mentioned in the audit. In the audit, there were abnormal transfer of assets. Then I think at our facility, at our capacity, we've tried to bring what is called the assets register in place. The valuation of land was an issue. I think this one is still an issue because of the dispute. There is a land dispute at the facility. The former HO began the process of acquiring the title deed, and we are continuing with the process. But I think the county can come in and help us in resolving the dispute, which is still at the ground. There was also a query of failure to meet the level 4 requirement. I think at Papunditi currently, most of the facilities are not there. Like the special clinics are not there. I think this one, the county can come in and assist the facility in bringing in the special clinics. Cash collection. In the audit query, they mentioned one point of cash collection, and the same point was being used as the billing point. We've managed to separate the billing area and the cash collection point. And currently, I think the cash collection has gone up. Hopefully, those are the only areas I can mention at the moment.
You are leaving important issues that you need to mention. I don't know why you would want to leave them and talk of others. Like the weakness in the filing system, there were no files. And you claim that the files were still with an officer who had left the hospital. You know, those are things that you would want to know.
Chair,
just a minute. You know, you go through the easier ones, like failure to meet level 4. The issue of interest, management of interest. Why are you leaving those ones?
Chair, I'm 4 months in the facility, and currently the audit, the basis of the audit gave me a lot of chances to do my line.
You've not answered me. Why are you leaving the two and you have them with you?
Currently, we are doing the proper filing system. Then the last one
You've not answered me.
Chair.
Chair, me, I don't know. From the start, when the officer started, I really got lost. I don't think he has even read the audit report. I don't think so. I don't even think he's abreast of what is there. So he's really gambling. He's struggling a lot. So I don't know if he's the right person to answer queries from Nyakachi County also. I don't know. I'm really lost. Thank you.
Chair. Chair, I think the officer said that the MedSoup is attending to some emergencies in Mombasa. But for you to be appointed by the MedSoup to represent him, I think you are his right hand. And furthermore, you are the administrator. There are two things I want to find out. When you talk of files, and you are 4 months old, I think there was handing over and taking over. Maybe you can tell us if your predecessor went with the files, so he did not hand them over to the facility, so that we know. 2, you talked of abnormal transfer of assets. No, that is too grave, abnormal. So where were these assets being transferred to? Maybe for us to know.
Chair, the files.
Before you answer, you know, you are here, you are supposed to be on duty. But the in charge decided to send you to represent the in charge in this meeting. And there are issues that were raised that we would want to know how to support the department come out of it. And you've really pinpointed around 2 things. You say now you've done it to the best of your knowledge. This issue that we are raising, that's why we invited the CC and the chief officer. They are here to listen to them, because some of them, they are the ones to sort out, to help you sort out. But if you're evading them, you want to appear to be, there was nothing. There is even a statement on unsupported bank balances. You could not support the bank balances. So those are things that you don't expect the officers. We would want to know, why were you unable to support the bank balances? Why were you unable to present the interest? Why were you unable to even to file documents? Because when you're telling me you've started filing now, what was so difficult for you to file at that time? Maybe there's a challenge of filing. We would want to know. Can proceed.
Thank you, Chair. I think we were found unaware when the files were not correctly filed.
What do you mean by found unaware? You see what? I think it's a daily routine that you need to be filing. You can't say that you are found unaware. You wanted the auditors to tell you that you are coming, put your files in order. Because I think it's a daily for people working in the hospital to be filing your things in order. You can't say that you are found unaware. Because there was nobody to tell you that. Excuse?
Just wondering, when the admin says he was caught unaware, who does the daily administrative job works at the facility? And when did the facility receive an invite to appear? Ah, okay. So, who does the filing? What is the work of the admin? Just a question of may I know?
Chair, as I've told you, I'm just 4 months in the facility.
You know, whether you are 2 months, just a minute. Whether you are 2 months
and
acting on behalf of the maid soup, we are assuming you are the maid soup. Because you've come to this place to represent the maid soup. So whether you are 1 month, 2 months, that's none of our business.
So I just brought the apology of the maid soup.
Asking the chief officer to see what to do with.
Hello, Chair. In a situation like this, we have the med soup and the administrator. Between the two in the facility, who does the filing?
It is the administrator who does the filing.
Then we have the right person on the floor. Proceed.
Yes, we put place the correct methods of filing, and currently our filing is in order.
Allow Honorable.
Chair, the officer is saying that is only 4 months old. But when you are employed, you must have been employed on the basis of the experience. And even where you came from, to the facility, you had some experience. Does this really need some induction in order for you to give a report that you're being asked to do? Thank you.
Wajib?
Chair, you see, that's why I told you I was lost. And I'm still lost. If this is a guy who is in charge of Papunditi, I'm still lost. I'm from Nyakat. I'm really lost. Because, Chair, you can't tell me, even a health center or a dispensary, someone in charge doesn't even know what you are asking about the audit reports. The queries are there. There are assets which are lost. There are files which are not there. He has no idea, even a clue of it. Chair, please. Thank you.
Help the members. One of the members from Nyakachi is lost. You must help him because he's lost. So find a way of giving an answer that can make him be found.
A critical report on the audit. We sat down and did a report, handed it over to the Medsup, and he was to represent it today. I don't have the report with me at the moment.
Then you can go to the next facility if you don't have the report.
Chair.
You are, no.
Hello, Chair. Before we go to the next facility, I think this is very interesting, and I want to confirm that the way the gentleman is answering questions is the same way is the same way the MCAs appear before the public. When we appear before the public and we don't perform, this is the same way they ask us questions. So when you are doing your work, please take your work seriously. I think, Chair, we move to the next.
I think as a committee, we are not happy with the way you handled the questions and the person who sent you to represent him here. So I think we are going to take some actions against the person whom you are representing and yourself as a committee. When we retreat for writing, we'll make some recommendation about you and the person you are representing. Because you need to take the work of this committee seriously. Thank you. Let's move to the next facility.
Thank you. Thank you, Chair. The next facility is Moroni County Hospital.
Through the chair.
Moroni.
Dr. Kwom. Dr. Kwom David, representing Moroni County Hospital. Moroni County Hospital for the period of audit, financial year ending 30th June 2022, received an adverse opinion as the report from the OAG. The issues are cutting across, as has been discussed by several other in-charges and leads of the department. From the hospital, we've categorized these issues into three. There were issues cutting across human resource. There were issues on the mispresentation of details in the financial statement. And the third part was on the inaccuracies on the figures presented on the financial statement for the same period. If I would start with the human resource, these are the areas that we need assistance on. The first area is on the accountants. As much as far as we are being referred to as here in other areas as accounting officers, we are not accountants. On terms of accounting officers, we take the responsibility, but to understand these figures and this financial statement, as a doctor, I would need the opinion of a qualified accountant on that end. The second part on human resource is on procurement officers. With these new rules of procurement guidelines for procuring entities, these hospitals offer critical services to your or to indigents or people who live in Kisumu County and beyond. Some of these services are emergency services, and you understand procurement processes are always not as urgent as services that we provide. So that means a delay in any of these would critically interfere with our operations at the hospital level. Thus, some of the adverse opinions, if these professionals are not availed at these entities to ensure this process is achieved within the guidelines of the law. The third part on human resource is on revenue clerk. We appreciate that the newly formed revenue board has been posting some revenue clerks to these entities. And it was an audit query using casual staffs to handle money for funds of the government. And I think in the recommendations of the committee, it will be appropriate to award or to find a way to get these revenue clerks deployed to these entities to ensure the collections are documented appropriately. I will go to the second part, which is on misrepresentation of facts and figures on the financial statement. Again, as it has been repeated here by several other managers before me, this was the first time we were doing this financial statement. So it was that some errors arose, some just during transfer of the Excels to the Word documents to PDF, some due to lack of experience and lack of knowledge of what these terms, accounting terms, would mean for these doctors and administrators without the help of the accountants. Thirdly, I will go now to specific queries that have not been discussed. I would start with the casual staffs. The issue here was underpayment, which most of the hospital managers have agreed that for us to comply, we have to have this within the budgets going forward. That is, from the period of audit until we are all compliant to the minimum wage bill or wage laws for the country of Kenya. Towards that end, we will want cooperation from the department and the county at large to ensure we comply comply with the labor laws on the minimal wage to our casual employees. The third part would be on the missing inventory and asset registers. This for Moroni County Hospital has been worked on. There's an asset and inventory register, even though it is not valued and the title deed had some issues due to some contested piece of land within the hospital. The fourth one was on the NHIF, and at this point the auditors just wanted to ensure we have files of the batches we submit to NHIF, and lastly the batches that are paid. All these have been availed and at the OAG for verification and forwarding to the Big Pack Committee and other committees that would need the report. Lastly, I would want to, on behalf of the hospital, thank the Department of Medical Services, Public Health and Sanitation on the digitalization process that is make our work a little bit easier with this, and it's become quite easy to produce evidence to these auditors when they come on just a snap on a finger, either on your phone or on the website, depending on the value on the IT text that we are using. Otherwise, thank you.
Chair, before we move to Chulaimbo, if you allow me. Chair, he's cited lack of revenue clerks as a reason that informed the involvement of the casuals in revenue collection. So have they so far requested the department to help them solve that? Or do they want us as a committee to make the recommendation on their behalf?
You can respond.
Through the chair, we've not made request formally to the revenue board. I think it's a recommendation that we welcome as the hospital managers.
We can proceed to the next hospital, Chulaimbo.
Through the chair, thank you for the opportunity. Most of the problems, if you realize, they cut across, so some we may repeat. And on the financial issues that we had as Chulaimbo County Hospital, some on the variances on the transfers from the county government, also differences in the financial statements and notes, and inaccuracies in the medical services income. Just as Waziri had alluded when he was making his statement, that some of these documentation used to be handed over to the department. And that's why when the auditors came, we had challenges in providing those documents. And also, because we are basically not accountants, even the HAOs, they are not accountants. So also preparing some of this documentation was a challenge. And as Dr. Com has alluded as well, that lack of knowledge as well. You know, it's better to say that I do not understand, and we are taught subsequently on what to do.
Doc, I believe there is somebody acting as an accountant in your facility, and you need to work together with them. I think it's not about you to make this, but there's some consultation within these hospitals where there's somebody acting as an accountant that you can always discuss with some of these issues.
At Chulaimbo County Hospital, we do not have a roving accountant at the moment, so it's a little bit of a challenge. And then also on the issue on FundSoft, initially what was handed over to me that at some point there was, I think, a third-party access that would sometimes delete some of the items in the FundSoft. But that has since been corrected, that we are able, even whenever we are facing downtimes with FundSoft, we are able to reach the provider and support us in the system. Issues on employees' costs, there was also a variance on the master payroll. During that period of auditing, financial year 21-22, there were some staffs who had been laid off, but because of pending, we still had their salaries, so it overlapped and it looked like we were overpaying from what we had budgeted. So some were laid off and we still had their monies, and there were new who were hired, so there was an overlap on that. And also on board issues, just as other facilities were affected, their term had expired, so we still used them so that our budgets would be approved for the AIs. But currently, we are having a new board that was appointed, that they are awaiting induction. And we have minutes and attendance list, and also we have their files, which was the gap during that period. Issues of assets, same across board. We do not have title deeds. In our asset registers, the assets that we have, some have not been quantified, so we've also requested for valuation of the same, and we are hoping that by the time the auditors come back, the register will be up to date. And also, I think also the issue at Chulaimbo, we've not had the issue of contested land from the community. I think it's just access of the title deed, and through the board, we are working on pushing on the title deed. We are currently cashless, so and the cash book is also recorded daily.
Is it cashless both day and night? Because some facilities, they are cashless daytime, but at night they do the opposite.
I can confirm that we are cashless day and night. At some point, we were facing a challenge on Sunday night, because also some of part of the query was the casuals do not have offs. So we have currently hired a secretary who assists on the billing department, so that there are offs for the staffs, and also now Sunday night is fully covered in the cash collection point.
Have a challenge with the M-Pesa?
Currently, no, but we have had downtimes when it is a nationwide problem. And I think 3 months ago, there was a time no one was able to withdraw or deposit money. And on that particular day, after consulting the department, we were allowed to collect cash. And when the system came back up, we deposited what we had collected and we went back to cashless. So the downtimes are when it's a nationwide problem. And also, another problem that affected us that probably the Assembly would recommend is in level 4 functionality. That is lack of operation services, radiology services, such that we have to refer to Kisumu for such kind of services. And Chulembo County Hospital is the hub for Kisumu West. So that one is beyond our control, probably from the departments, but I can confirm that some work is going on, and we've been promised that before this financial year ends, some of the services will have started operating. That's all I can talk of.
There was an issue of infringement of casual workers' rights, that they're working 24/7 without going for any leave, without going for any rest. It is captured here. I don't know whether you've sorted it out.
Yes, we have, and that is why I've said that in the departments where they were not able to go on off days was majorly the billing department, because we all know how revenue is very crucial. So they would work throughout, Monday to Monday, but we hired a third person to allow provision of offs.
There's an issue that is cutting a course. I've seen it in most of the reports on the weakness of in-filing system, where they are indicating that the hospital did not have a systematic filing system for both financial and procurement records. It was difficult to retrieve information for audit purposes. In addition, most procurement files were still in custody of a former officer. This former officer is in most of these hospitals. We would want to know this former officer who doesn't want to release the files, this former officer.
For Chulembo County Hospital, during that period, there was a transition from a former admin to the current admin that we have. And there were certain documents that were not handed over. But we've since improved on our filing system, and even at that time, there were not even filing cabinets, and currently we have that. Probably what may be missing is what was not handed over to her during that period.
Chief, why would an officer fail to hand over documents for the hospital? That period of, a long period of time.
That was not brought to our attention. We would have acted. You know, what Honorable Seth mentioned is really what it should be. No officer should say that he's moving away with government property. That is really criminal. And we may need to follow up that issue after this.
We may need you to submit a letter, not on air, meet that officer who refused to hand over. I think a similar issue was in, is it Nyakache or Maheo? Nyakache. So we'd want to know these officers who leave office and fail to hand over documents belonging to the county government. Maybe 4, so that it be part of our report. Thank you. The next station.
Chair, that is, we have had UTRH, KCRH, Kombewa, Hero, Nyakach, Mkuruni, and Chulaimbo. Gita.
Chair, before Gita. Chair, I think the issue is the issue of the officers not surrendering files during handing over, taking over. I think it's a serious concern that if we not get the response, then they'll need for us as members to raise a statement on the same in this floor.
Chair, I've said it's going to form part of our report. All the officers that do not hand over fully, action must be taken against them, and we'll recommend in our report as we retire to do the report. Let's have Gita and Lumumba. I think Lumumba will be the final facility. Gita.
Good evening, members.
Good evening.
So I may not have much to speak for Gita because we were not audited. We have come to see what we expect.
Yeah, Gita was not audited, but you are in the line.
And Chair, I can confirm that Gita and Koyo Dispensary are doing so well in Kisumu. Just keep it.
Koyo is not a county hospital, but thank you for that positive remark.
Chair, I don't agree. We cannot confirm yet they have not been audited. until they will be audited.
Lumumba is where the accountant disappeared for 3 days, and we never saw her. I think the maid soup is here. That is the maid soup. Who are you?
I'm the hospital administrator.
Where is the maid soup? Huh?
She's present.
Are you having a problem? You can't. A good boss. I proceed.
Thank you, Chair. Mainly the basis of our audit report was on non-compliance with the prescribed financial reporting template. We had inaccuracies and variances. And Chair, initially we thought we had done very well because we had an accountant attached to our facility. And the year following 2021-2022, what we did at our facility after this audit report, we made sure that our financial report is subjected to review by the departmental accountant. And currently is under auditing, and the preliminary report, Chair, it's recommendable. We are getting good report from the auditors. So there's a lot of improvement with a few amendments. Other issue was on variance of NHF receipts and bank statement. Chair, there is what accountant says accrual system that we came to learn that every claim you made from NHIF claim is a revenue. As what we used to declare is what has been reimbursed. And so it came as an audit query. But our fear was, Chair, if you were to declare the claims, our fear was that a query will also arise, how do we account for what you actually declare as revenue? Because as we only consider what has been reimbursed in our bank statement. So that is a concern. We'll get to learn from our big brothers how they are handling such issues going forward. Other issue share was the failure to open FIF account. And this was beyond us. I'll leave it to the department to guide on how to open FIF account. It was an issue that was raised by auditors. Other issues were failure to establish audit committees. Again, we as a facility, we rely on internal auditors. So we, as a facility, we don't have the capacity to have internal audit. Chair, by your guidance, other issues have also been raised that I may not want to go into, like lack of ownership of land documents that had been raised, non-compliance with the Kenya quality model for health at our level. There's a level of staffing that's required for our facility. Then lastly, there also issue of pending bills, but our concern mainly what was raised, that there are a number of bills that are taken time without being payment being made. But I'm happy that the department is currently on the process of reviewing all the pending bills with the aim of financing for them to be paid. Thank you, Chair.
Thank you. I think that marks the end of the facilities, and we have friends of these facilities, like the sub-county, that is Manyuanda is here. Say something, so that your voice can also be captured and answered. Manyuanda?
Hello. Thank you, Chair. As I said, my name's Charles Usula. the HAO Manywanda Sub-County Hospital. We didn't come here to spectate, just as one of the members said. We came here to take note. We are also learning, and maybe to share with other colleagues. We are in the correction trajectory. What we have seen here, what we've heard from our department initially, and I think it is a continuous process of learning and training. We are also preparing for the same. Thank you.
Is here? Gita had spoken. Which other hospital is here? Okay.
I would like to take this opportunity to maybe again say my name. I'm Karen Atta. Just like I've heard from my colleagues who have been through the process, we've learned that there's no excuse that previously you are not there. You have to pick from wherever it was, and make some kind of improvements. I hope that this will make us make a difference in the facility and in the community in whose life we share. Thank you.
Thank you, Nyangande.
Good evening. Thank you, Chair. I'm Beatrice Atieno, the facility in charge, Nyangande. I came to learn, and I'm happy I've learned. Thank you.
Nyangoma is in. Nyangoma.
Okay, thank you so much, Mr. Speaker. Sorry. Mr. Chair, for this. I'm Stephen Anyul. I'm the health admin for Nyangoma Sub-County Hospital. It's a good season to us that we were here to learn all together and also to get prepared for our next time in case we are called for this. We also learned that as the administrators and the facility in charges, we need to take charge of everything in the facility and we be responsible for our work that we are doing. We have no chance to explain a lot of our excuses, but we are supposed to take full responsibility when it comes to accounting. Thank you.
Which one? Migosi. Migosi.
Good evening. I'm Evelyn Metobo, Migosi. Through the chair, the facility got audited. And as from what I've heard, I'm preparing to sit again here because I know the queries that have been asked, I know I'll be asked. Yeah? So this is a very good moment for me to go and prepare for the answers. I know everything that, the auditors camped in Migosi for more than 7 days. And it's real. And this gives me courage to go and prepare for the answers. I don't wish to get an adverse or disclaimer, but again, it is an eye-opener that as a facility in charge, we need to take charge. And sometimes some documents that are within the department, I'm sure they are supposed to be brought down to us so that they are not, we don't look like we don't own the facility. For example, they asked me about photos, the CVs, and everything about the board members. I mean, I just got the Gazette notice. I didn't get the rest of the documents, So it trickles down to me that I'm being audited for that. And yet, Dr. Lucy should have given me those documents, right? So next time we are being called here again, I'm sure Daktari will be accompanying us to share with us. Yeah? So, yes.
I don't think if that is the responsibility of Dr. Lucy. Because once you see the gazettement and the officers have come to your facility, you need to ask for these documents and you keep them in the file. That is your responsibility. Thank you.
Thank you for that. I'll make sure I do a follow-up. I know, okay, on a light note, but it is very key that we follow up these papers and all that is required of us. You know, thank you so much. And thanks for this opportunity. You didn't invite us, but it was worth coming over.
Thank you. Any other facility? So we are done. Members, oh, there is one there. Okay.
Good evening. Once again, I'm Elizabeth Anyango Okach, the facility in charge, Rabur Sub-County Hospital. Yeah, we were not invited, but if I may say, we just get crushed because we really yearn to see what our seniors, if I may call them so, what they were doing and to emulate the good work they are doing and the correction that we correct on what they didn't do good. And have learned today that as the facility in charge, the buck stops with me. And as the Swahili saying says that, anyolewapo mwenzako, chako tia maji. Asanteni.
I hope you'll have enough water to... Anyway, members, we are concluding. Any final statement before we go to the CC member?
Chair, I just want to thank them. And as Migosi said, you know, when you are in Pick Park, this health committee, this is not Pick Park. As those who have been there, he's been there, she has been there, and KCRH, GRTH. When we were on Pick Park committee is a different thing. This one, we are just curing what we have seen coming very often in all our facilities. Mr. Chair, on matters Nyakach, please see into your wisdom. You call the in charge, I think on a different date so that we can go in this session with him once he is available. Secondly, I would request the department, this issue of accountants, if we would have a system where now all the facilities will be assisted to do these books, the books are terrible. The balance sheet, whatever it is. So if we would have a system or from the department side, so that we assist all the facilities. Now, Chair, it is even coming that even the sub-counties are being audited, like, is it a county or sub-county? Sub-county, yes. So they are also being audited. We have received the county hospitals. Now they are going down to sub-county. So it needs capacity in terms of accountancy. So I don't know how we can cure that as a recommendation. Either we give all of them accountants, or if we cannot, then we see how that system can work. For example, in high schools, the secondary schools we have accountants at the sub-county level, where they go and audit those schools or help them. But in our scenario, we have the capacity to hire and get them one or two. Because you saw, it is really terrible. These are doctors, most of them, and they are not able to do this accountancy work precisely as needed by the auditors. So the auditors are accountants, CPAs, so they really need something tangible to work on. Lastly, Mr. Chair, this session was very good, and I want to appreciate our people who are working on our facilities. We need to pull up our socks. All our facilities have gotten the bit, I don't know, adverse. Maybe the two of them, the JTRH and the KCRH,
the rest are really terrible. So we need, like, when we come here next year for the same session, most of them shall have gone up to get a good report and recommendation from the auditors. Thank you, Mr. Chair. Thank you.
Mark, Honorable Seth.
Thank you. Thank you so much, Chair and members, and I want to thank all the in-charges and the department for agreeing for us to hold this meeting. This meeting culminated out of the audit reports that we were handling in this assembly, and we felt that we cannot continue like that. It was good that we handle some of these things as health committee with the department before it can escalate any further. Honorable Chair, I want to tell all the in-charges, please be acquainted with Public Finance Management Act, especially Section 149 and the preceding sections. It gives you your responsibility as an accounting officer so that you know what you are supposed to do as an accounting officer, and please ensure that you do it unless there's any other good reason that you can't do it. I want to give you a case of, let me not give you that case, but let me explain that. Now that you are a procuring entity, it's very easy for the department to tell you, come and sign here, and they've procured items worth 3 million, and they've used the name of Migosi or Kombewa or somewhere. And then you sign, and then when it comes to accounting, it's not them, it's you will be asked as the accounting officer, because it's believed that while the procuring was being done, you are the one responsible. So please, I know for now you have very honest leaders at the department, but this might not be forever. We are here for a season. We might not be there tomorrow, but you might remain an in charge in that facility. Chief Officer and Waziri, please, in the coming audit reports, for example, an officer did the audit reports for your TRH, then you are transferred to, let's say, Kombewa. Then we invite somebody, then you call for us somebody that you just took to your TRH 3 days ago to come and answer queries of somebody who was there but is just in your TRH. I think it's good that we address this so that you bring the person who was present when the audit report was being made, because they do not leave this county. They're usually just within, but they just change. I think that's what happened, Chair, when that lady, I don't know, the one for Lumumba, ran away in the pretext that she had a transfer letter. So she felt like she was not responsible. I think that needs to stop. Lastly, we need to work together in the subsequent budgets with the CC Finance so that we have sub-county accountants to help us with these facilities. I think if we can have 7 accountants at the sub-county level, then it will minimize all these audit queries that we are having. So it's something that we need to have a plan on as we are going to the next budget. Chair, I'm almost finishing. We have funds, Chief Officer, especially we did one on COVID emergency fund. I think that was another fund that is under the Department of Health, if I believe so, that was not handled well in the audit reports. And you know, when we have another emergency, let's say cholera or something, then we might have problems creating another fund when there is need. So for the accounting officers that we are giving for such funds, please help us manage these funds properly so that we do proper reporting, so that when we, in case we need another fund, then nobody questions the essence of that fund. Lastly, we are here as a team. We are doing all this to make our service provision roles better. This is not witch hunting. So, and that's why we felt it wise to call all of us here today, so that we prevent some of these things. Past this, like my brother said, when you are now in the Public Accounts and Investment Committee, and Dr. Kwom will tell you, now it's different. Now we'll just tell you the sections that you have broken of the law and the punishment that you are likely to get. And we don't want to get there. So please heed to any of the experiences your colleagues have had and make corrections where necessary. Thank you so much, Chair, and thank you so much, everyone.
Fujo, 1 minute because of time.
To do seconds, but now that you've given me a minute, I'll struggle to get more words to complete that. Thank you, Chair. Chair, I want to echo the sentiments of my brother that really we would want to coexist as a family. And with that, we'll be able to achieve a lot. We have achieved so far. I'm very proud of this particular department with those small issues. We know going forward, if we continue like this, we'll achieve a lot. And that is what we are looking forward for. This is a competitive world, and we want to compete with the second assembly so that by the time we finish our term, the Department of Health, together with the committee, should be seen to have actually achieved something. Chair, in regard to the accountants, we need to support them. Let them put in a recommendation for a request for more accountants to be employed. I can see quite a number of our members are members of the budget committee. And then we support that, because what we are losing is more than what can be paid to the staff if we employ them. The other thing, Chair, I would encourage these young people really to work hard. As we don't have any malice against you people, we would really want to see you grow. Like your seniors here, also my friend, Dr. Lucy. So that when Lucy exists, then there will be more Lucys. When Dr. Ganda exists, there would be more Dr. Gandas with professionalism, experience that we have seen in him. We don't want anybody to lose his position by virtue of being verified in this committee. Allow me to ask the chairman to consider his recommendation that you'd want the Nyakach administrator to be warned, or as the recommendation is taken. We will just deal with this matter like any other, but if given a chance, I'll ask the administrators or the bosses that if any as recommendation.
Member, you're out of order. You have no powers to challenge the chair. Stick to your mandate.
Thank you, Chair. Thank you for getting me back to the line. Finally, Chair, I want to state here that this particular department and roads are the departments that even in the rural area, a stranger can abuse you in any of the funeral. For example, a stranger comes to the funeral, finds someone has died in the hospital, claiming that their hospital mismanaged the patient. Then they start abusing us, oh, the hospital is like this and that. A stranger, not even your competitor in the rural area. The same with the roads. You meet someone in the funeral who has just come from Malego or Ugenya saying, do you have an MC in this area? The roads are terrible, this and that is terrible. So with roads and health, we would really, really want you to cooperate with us. We work together and deliver the services to the people that we represent. Thank you very much, and God bless you.
Thank you.
Mine is just to appreciate the facilities and the department for positively responding. This is an indication that our facilities are really positive and geared towards improvement. I just want to encourage the facilities not to shy away from sharing their honest challenges with the department. We are blessed with a super CC and a super chief officer. Actually, this is the department that is more blessed than any other department. And as a health committee, we really value the health department. because even in regards to revenue collection, I can say I can give you a pat on the back. But I'm really happy that you showed up, and we are going to work this work together, as the chair said. And I know the next audit will give us an unqualified opinion. I believe because you are ready to learn. That's why you're here. Thank you.
Thank you, Deputy Chair.
Thank you. I won't really say much because most of the points have already been talked about by my colleagues. But I'd like to encourage you to keep up the good work. You know, healthcare is actually one of the key pillars on the development of the county. So you've been charged with the responsibility of providing quality healthcare to the people of Kisumu County. So I'd like to encourage you to exercise proper financial management practices, because by doing that, we'll be able to improve on our services to the people of Kisumu County. Otherwise, thank you so much, and thank you to the department also for responding to this, and also for creating time to come and be with us. Thank you.
Before I give the CC and the Chief Officer time, maybe have the following in mind. One, you need to work on the issue of level 4 hospitals, the requirement of a level 4 hospital, put it in place because it's cutting a cost board. Two, the issue of title deeds for these facilities, let it be part of your agenda to the department. Number 4, the hospital board for KCRH, check on the hospital board. I don't know whether you have plans for the new board. Okay. Number 5, on the issue of FIF, I would want to request all these facility in charges. I know you've now tested how FIF operates and the Act, and you know the challenges that are there. Maybe you can give us recommendations. This one should be done within this week, because we are having a plan of reviewing the Act of the FIF. If you give us recommendation, what you feel, how you feel, we can discuss with the department. When you are not there, we'll invite them and discuss on the FIF with them. But we need to get it from you, because you know where the shoe is pinching. So we need to get it from you on the FIF. That one should deliver, each hospital should deliver a recommendation latest this week, end of this week, on Friday at 5 p.m. Should get it from each and every hospital. Then we all know that there is a shortage of hospital staffs, that is the healthcare staff. And we all know that people always retire each and every year. We should not wait for the board to tell us what to do, but the department should come out with a plan on how to replace those who retire. Because even this year, I know there could be a number. We don't need to wait. We need to push the board and maybe give them a list of the number that you need on each financial year, because we budget for them every financial year. Because even this year when we'll be budgeting, we'll budget for even those who are going to retire this year by December. But we'll budget for them up to June next year. So it's upon the department to give us the list in good time, so that we also push the board and push the board to announce how to advertise for these positions, and then they be filled, so that you don't have shortage that we can manage as a department. I think those are the issues. The last one, we'll discuss with the CCM, Dr. Ganda, on a way on how this team can be inducted on certain issues. I know there are some that Dr. Lu said that we cannot induct you on how to keep a file, but there are some that we can. So we'll discuss on how we can get some money for doing induction, and think that induction will be for both this team and also the health committee team. So we'll do it as a joint induction together. We can find somewhere near where we can go and do the induction. Maybe a 2-day, 3-day workshop will be okay. If we can't do it on a weekday, we can do it on a weekend, depending on how we'll agree with the department, so that so that we can have this knowledge, so that we can also it can also help us cover this in the next auditing report. I think that is what I wanted to share, and I'll give the CC member for health to say something, then I will close. If we can start with the chief, then chief will invite the CC member.
Thank you, Chair. And I want to really appreciate on behalf of the department this session, Chair. You kept on asking a question many times. What is it that this Honorable Assembly can do for you? What can you do for us? And a lot of my people really were not listening to that question, right? But finally, I think it came out clearly what our needs are. And we thank you very much for this. You know, Chair and members of the Honorable Assembly, when I visit some of these fellows here in the facility, they say, oh, Dr. Lucy is shouting. Now you can see. Now you can see, right? And when you say that, Dr. Metobo, when you say that I will come here, yes, I will accompany you to the assembly, but I will not accompany you to jail. The assembly I must, because it is an order. But jail, you will go alone. You know, don't come here and begin to show a lot of ignorance, and you look like you don't even work in those facilities. So be very careful what you do. Every document, accountable document that you're supposed to keep, please keep them. Give auditors a hard time. You know, auditors are like policemen. They will find questions to ask you, but don't let them ask you, don't expose yourself. And Chair, thank you so much for exposing my people to this kind of stuff. And Pig Park is waiting also. I don't know what Akwom was exposed to, but so it's not a laughing matter, you people. You saw the way Bernard was dealing with the issues. Very professional manner, professional answers. That's the kind of thing we want. So that even if you're a criminal, you appear like you're not a criminal. Otherwise, Chair, thank you so much for this exposure. I will, as brief as that, and I will wish to have my Waziri now to finish up. Thank you, Waziri.
Akum wanted to know whether we are going to surcharge him.
Okay, thank you very much, Chair, and thank you, members of the Assembly, for this good session, which is actually building on to our objectives. I think I'll just, now that Dr. Lucy has said the thank yous, I will not repeat, but I've just picked up a few issues that I think we need dealt with. I think the issue of waivers and exemptions, you realize the waivers and exemptions in the FIF Act might not be in line with the PFM Act, and we might need to look at that again, because they say that only the CC Finance can give a waiver. So how will our people who can't afford fees be taken care of back inside the villages? And then I think another recommendation is that we need to separate those revenue accounts from the expenditure accounts, so that revenue goes into one bank account and expenditure goes into a totally different account, so that it becomes easy to manage them. I like the recommendation by Honorable Seth on the sub-county accountant, but I would wish it to upgrade it to a sub-county accounts office, which probably maybe has more than one accountant, maybe a clerk and a filing and a cabinet, so that these documents are also available at that level, so that even if you are doing it in duplicate or triplicate, the sub-county accounts office must be able to have all those documents. I think we've taken the recommendation that the person, because all these people are within this county, that during the audit period, we probably need to bring the people who are there to participate in the audit process, so that we don't end up with gaps. And I think we've taken that positively. Finally, we also had our retreat with the Department of Finance, and just to relook at this FIF, and I know we used one of your legal officers to take us through some of the things that we need to relook at in the FIF Act. now that we've implemented it for 1 year, and I think the report shall be given to you in due course. But one of the issues that we looked at was the fees and charges in our County Finance Act. I know all the fees that we recommended were not taken, and whatever was published was the old fees. And if we look at having a sustainable model, more so for the level 4 facilities, we are running them at losses, because what we are giving them plus what they are charging makes them go on a negative. So, for example, JOTRH is suffering greatly because of that. So we are always going to be moving into debts if we are going to survive to run those services. So I believe we should be able to look at those charges in view of the realities on the ground. And finally, there is the issue of, I think we'll come up with a roadmap, a legislative roadmap together with you for us to look at how we can enact recommendations that have come up from this meeting. We need to develop regulations and operational guidelines. I think that was missing in the last 2 years. We've not given our MedSoups guidelines and books to read when they are appointed, so that apart from the training, they have a book that they can, that is actually outlining what they need to do step by step and make it easy. I think that falls back on us. You've talked about the recruitment and deployment of accountants and procurement officers, which I think is needs to come out as a recommendation. And these could all work in the sub-county accounts office, because the bigger facilities can have their own accountants. But the problem is going to be worse once shift comes in, and each facility is going to be given money directly, and that money they have to spend. And so we'll get into the same problems of no accountants in those small facilities. So the sub-county accounts office really has to be strengthened to be a full procurement and accounting office, to be able to keep facilities. Those facilities, the 2 nurses, 1 nurse, they might not be able to keep this documentation. I think that's all from me. Thank you very much for the session, and thank you for giving us time to be here, and for all the comments that have been made by the members of the Assembly. Over back to you. Thank you.
Legal services, I think before you engage somebody from the Assembly, just a procedure that you engage the clerk or the speaker, or maybe you can consult the chair, because some of these legal officers, they come here on attachment and they leave. You may be engaging somebody who is not working here, because as far as I know, at the moment we don't have a legal officer. So I don't know whom you engaged. Maybe it's a stranger to the Assembly. So you need to be consulting before you engage anybody, because there are some that were working but they left. So before you engage anybody, ensure that we know that we want to engage somebody from the Assembly. The speaker, the clerk, or the chair should know that you are engaging somebody. I'll ask Honorable Deputy Speaker to lead us with a word of prayer as we close. Thank you so much,